This podcast is for educational and informational purposes only. It should not be used to substitute the advice from your medical professional or primary care provider. If you are having any kind of medical issue or emergency, you should call 911 or go to your nearest emergency room, urgent care center, or consult with your doctor.
Welcome to Healthcare Snitches. Hey guys, and welcome to Healthcare Snitches.
Welcome to episode 10. Wow.
We've been doing this for a long time now, about 10 years.
Right, feels like 10 years. Goodness.
It does.
All right, before we jump into our episode, just wanted to remind you guys to find us on YouTube, like our channel, and subscribe and turn on your alerts so that you can get notifications when we post new episodes every other Sunday.
That's right. And as I always say, tell your mamas, tell your cousins, tell the dog walkers, tell everybody.
Tell your aunties, tell your mailman, tell your barber, tell your doctor.
Everybody.
Tell your boo, tell their boo.
Tell your connects.
Tell your pharmacist.
The street and the ones that are illegal.
Right. Tell your dogs. Tell your fish.
Okay, so I just want to start by saying, child, my eyes are messed up today. I got a star on this eye, and my allergies got this eye pink. So before y'all talk about me, let me talk about myself. Don't judge me. My eyes are messed up today.
I don't see anything.
No? All right, well, hopefully I still look cute.
Yeah.
Okay, so today's topic, we are going to discuss medications. We are going to talk about taking expired medications. We are going to talk about polypharmacy. We're going to talk about making sure that you tell your doctors about all of the medications and the supplements that you are on. And we are going to discuss why is it that folks think that you are supposed to take antibiotics for everything. You be like, oh, my pinky toe hurt. Let me take antibiotics.
Right. You go to the doctor. You're like, oh, my throat hurts. I need a Z-Pack.
Yeah. And some of these doctors be out here prescribing.
They do. Because they want to get you out of their face, actually. That's why they do it, to be quite honest. And it's annoying to them, too, because I used to hear all the time, I'm sick of patients coming in and requesting antibiotics. They think they know what they need.
Oh, you used to hear that?
All the time. Common complaint. Yeah.
But they would still write it, right? So they're enabling these
Sometimes people. Because if the patient comes in and they're very adamant about the fact that they need an antibiotic, they will write it just to get them out of their face most of the time.
That's
and
crazy.
Because sometimes it covers a multitude of things, they just write it to get them out of there.
That's crazy. Well, I wanted to start off with taking expired medications, but we are already on antibiotics. So do you want to stay on antibiotics?
Sure.
Oh, and we're going to talk about lisinopril and ACE inhibitor. We'll talk about that. All right. So we can start with the antibiotics. So antibiotics treats infections caused by bacteria, right? So that's known as bacterial infections. And I just want to give you a little, just a little background, just a little thin piece. When a drug does not work well, that is known as, when it doesn't work well against different strains of bacteria, that is known as antibiotic resistance, right? So if you are misusing or overusing antibiotics, it can lead to antibiotic resistance, which can lead to a whole bunch of other problems if you have something major that needs to be treated and they cannot find an antibiotic to treat you. So,
right. I want to also point out real quick before you continue that the reason why doctors get annoyed when you request an antibiotic sometimes is because if your infection is viral, an antibiotic is not going to help you. Whatever the virus is has to run its course and get out of your system. And so that not only is prescribing an antibiotic counterproductive, but then you also start to build up what Kim is speaking about in that resistance, because you're putting it into your system and it's not even fighting against anything because you don't have a bacterial infection, you have a viral infection.
Exactly what Jasmine just said. So antibiotics do not treat viral infections. Work with me. It's my eyes, not my mouth. Antibiotics do not treat viral infections. Stop going to the doctor asking for antibiotics for bronchitis, for a cold, for a runny nose, for a cough,
for the
for
flu.
coronavirus.
Right.
It doesn't treat it.
It doesn't.
It's not going to cure it. It's not going to make you less contagious when you are around other people in X amount of days, like an antibiotic may. Stop it. Cut it out.
Right. The reason you go to the doctor if you're feeling sick like that is to identify what you are actually sick with, so that they can prescribe you the correct course of treatment. So, yeah.
Yeah, exactly. And please, we will talk about expired medications, but when it comes to the antibiotics, I'm going to need for y'all to get rid of whatever you don't use and stop saving it for later. Because if it expires, it can grow bacteria on it, not the kind of bacteria that you want.
Okay, so in my doomsday kit, they said you should have antibiotics. They say you should have antibiotics in there.
Make sure they're not expired, huh?
Ooh, okay, so I'm gonna update my doomsday kit so it.
Why you didn't tell me I need a doomsday kit? I don't have one. You just gonna let me die?
No, I got you.
Was it useful for the earthquake?
Doing that?
Was there something on there for some traction?
Right.
Okay, so another thing that we wanted to touch base on when it comes to the antibiotics pretty much get rid of good bacteria, and it also gets rid of bad bacteria. So even though it's treating you so that it can get rid of the bad bacteria, you don't want it to get rid of the good bacteria, but it tends to get rid of the good bacteria as well. So taking a prebiotic, a probiotic, or some type of fermented type of food like yogurt or sauerkraut or
kombucha,
or kimchi.
Yes, kimchi.
For some reason, when I say kimchi, I want to go kimchi.
I can't.
But that's the vibe that it's giving me. But yes, kimchi.
I can't. Mm-hmm.
Yeah, so these are all things that you should take.
Something with some probiotics, prebiotics, postbiotics.
Yes, that's
all three of them if you can find it.
So all of those things will help to re-up the good bacteria that was killed by the antibiotic.
Yeah, recolonize. And it can help to prevent or minimize
the stomach upset.
The stomach upset and the diarrhea that may come with taking an antibiotic.
So there's two classes that are pretty known to, like how Martin's mother used to say, slice and dice. Slice and dice the good bacteria. That's the tetracyclines and the macrolides.
Ew.
Yeah.
Okay.
So for sure, if you are taking any in those two classes, be sure. But I always have people take it no matter which class of drug
that
they
will
use.
Slice and dice your stomach right on up, okay?
Yeah.
I'm on a tetracycline right now.
Yeah, it definitely will. You're on tetracycline?
I'm on doxycycline, which
you
is in that family.
You are not taking a pro or prebiotic,
I am.
Oh,
I am.
Okay.
I am.
Okay.
You know, I can't be giving advice and, you know.
We do it all the time.
We do it all the time. But I am. Because I can't afford, I ain't got but so much stomach, so.
Okay. Okay, so that was that. Anything else you have with the antibiotics?
You already said don't take the expired ones, so that's a good point.
And don't take it because you got a headache.
Yeah, don't take it just because honestly, that also helps to contribute to antibiotic resistant viruses as well. So if we all keep taking it and we are all becoming resistant, then you end up with things like super gonorrhea, which now is a strain because the antibiotics that we have out aren't killing it. So, fun fact, it affects our entire population, not just you.
Yeah. And then also one other thing I would like to add is a lot of people, which I have done it before, you start taking antibiotics, the side effects are so bad that you stop cold turkey. It's not going to help you, number one. It's not going to cure whatever you were trying to treat, and it's going to contribute to antibiotic resistance. But those times that I have stopped, I've called my doctor and I've gotten something else to take.
Yeah, you want to get something else. You want to call them because they're going to know based on the type of bacteria that you have what is going to kill it.
Yeah.
So That's why that's important. And if you're allergic,
like me, to penicillin,
that could be an issue too. So
it is an issue for me.
Sometimes you don't find out until it's too late. You can end up really, really sick from being allergic.
Or have like an anaphylactic reaction and going home to glory and they don't save you in time.
Right. Or have that Stevens-Johnson syndrome.
Yeah.
I think that's what it's called.
I don't know, but we're going to roll with that.
Yeah. Which is also deadly.
Yep.
Yikes.
Okay, so the next thing is taking expired medications. So when you take these expired medications, I need you to understand. Number one, they can be less effective, right? But there's a chemical composition that actually happens, and it decreases the strength of it. So let's say that you're taking something, let's just say an opioid, for example, a painkiller.
Okay.
I have some Percocets on my dresser from 2021. I should probably dispose of them.
Yeah. How do you dispose of them in a safe way?
We gonna cover that.
Oh, okay.
So
I'm new here. I just got here.
Let's say you're taking Percocet for a toothache. Normally, Percocet starts working within 30 to 60 minutes because it has to dissolve, and there's a possibility that if your Percocet is pretty old, you just popping perks
for no good reason.
Yeah, and it's not going to help. So that's what I mean when I say there's a decrease in the effectiveness of it.
But did it kill you? Like, will I die?
Well, based on my thing here, because some medications have bacterial growth, I know for a fact that it's antibiotics. I don't know about the bacterial growth about the opioids, but anything that you take that is expired can lead to some type of serious conditions going on.
Yeah. Also, just one thing I thought of, you want to make sure you're storing your medications according to their directions. So if it says to store in a cool, dry place, make sure you're doing that. Don't have it in the trunk of your car in the hot summer heat, right? Like, let's be mindful of what we're doing, because I feel like that can contribute to it growing bacteria.
Yeah, or not being as effective.
Yeah, it's like make sure it's closed, sealed, tightly, stored in a cool, dry place.
So pretty much, do not use expired medication. Excuse me. There's no guarantee that it will be effective, and there's no guarantee that you won't go on home to glory.
Right. You just don't know what's going to happen. So if it's a prescription, it usually has a date that you should use it by. If it's past that date, don't use it. So you can get a refill. And then if it's an over-the-counter medication, just get a new one.
So it says here that some medications have specific disposal instructions. Have you ever seen that? I've never. I wasn't looking either, though, to be honest.
I gotta be honest. I'm not the best at disposing of medications in a safe way.
Me find out you be walking down the street just tossing Percocets.
No. I sometimes flush them down the toilet. Is that how you're supposed to do
it? Maybe.
Okay. I make sure I take my name off them prescription bottles, though. I know that.
I do that.
Okay.
I do that.
I rip it up in tiny
pieces.
And
I put them in Ziploc bags and put it in the garbage. I'm sure that's not the best way to do it either.
Okay. But what do you do with the actual medicine?
That's what I put in the garbage in a Ziploc bag.
Oh, okay.
And don't do what I do. And I must confess, since this is an honest platform, certain medications I'll keep for a year after.
And then what?
I'll take them during that year that they've expired.
Oh, yeah, you have done that.
I have.
I was going to call you out, but
I'll call myself out. I'm calling myself out.
Well, I
have done it. I have done it. But did I die? No. But I don't save antibiotics.
Okay. So not recommend.
No. Let me throw out that clindamycin when I get home from about 2 years ago.
Yeah. Because when you got that clindamycin, you were going to take an expired clindamycin.
First. So that I can save that
right. One. But we got through that.
Jesus fix it. Jesus fix it. I'm going to throw it out wrong and put it in a Ziploc bag and put it in the garbage when I get home. Okay. So it says.
I can't.
They have this take back program, and that's the way that that they would prefer for us to get rid of medications.
What they doing with the medications when we take it back?
I don't know, but
they found out they selling it on the street.
I didn't really look into it, so y'all Google it. Take back program for medications, and y'all let me know what y'all find. But it says when that's not available, federal guidelines. Listen to what they recommend. They recommend that you either use kitty litter or you use dirt to put the medication in, and then put it in a sealed container and put it in your regular trash can. So what's the difference? I'm just missing the dirt, but I do put it in a Ziploc bag.
They said if it has dirt on it and kitty litter, nobody will dig it out the trash to take it.
That crackhead who on the corner eat tuna fish out the can, he's going to rinse it off and he's going to take it.
He's going to blow off that dirt and that kitty litter, dust it off on his shirt.
Exactly. Or
pop that perk.
They said some liquid medications that are toxic, which made no sense to me, which are toxic and harmful to kids and pets. They said that we should pour it down the drain and run water behind it or flush it down the toilet.
Oh, okay.
Why can't the kitty litter absorb it?
It's doing too much, and nobody's doing that. I have promethazine from 2 years ago as well.
I was on that when I was pregnant.
Were you?
Yeah.
For nausea?
Yes, it did not help.
No, it didn't.
From how many years ago?
Like 2.
What's your expiration date? Last year?
I don't know. I think I may have thrown it away. But...
Put it in a Ziploc bag. Okay. Anything else with taking expired medications?
Don't do it.
Yeah, I'm gonna do better.
All right.
I'm gonna do better.
When in doubt, throw it out.
But I don't be in doubt.
You don't. You know.
I don't be in doubt.
If you got a second guess, trash is best.
I don't never second guess.
I just made that up too.
And I like it.
Look at me. I'm
a rapper. Freestyling. Yeah. I love it. What's your rap name gonna be?
J Dizzle.
J Dizzle?
Yeah, I don't know.
I always think about DJ Jazz, and I'm gonna tell you why. Because you be in a car and you be hitting the ones and the twos, and yeah.
Okay.
I was thinking DJ Jazz.
All right. That kind of reminded me of DJ Jazzy Jeff, which like
I think you're better than him.
Oh, he's legendary.
He's an ancestor.
He's not dead.
In my head.
How'd you killing him off?
Okay, so polypharmacy.
Ooh, polypharmacy.
Polypharmacy is the use of pretty much multiple medications. So if Bernadette has hypertension, she's on metoprolol. Bernadette has migraines. She's on something for migraines. Topamax, okay. She has seizures. She's on Keppra. She has high cholesterol. She's on a statin. Just all that stuff. Poly, taking all these medications, right?
She has heart failure, and she's on
lisinopril for heart failure. Ooh, child. It treats heart failure too.
Oh, because I'm like, that wasn't in my research. So she's on a bunch of stuff, and usually this goes for older folks, or it could go for folks that are younger and have a lot of chronic and serious conditions, where they have to be on medications for these things. I also like to mention supplements with polypharmacy, because sometimes our vitamins and supplements that we find on TikTok or wherever.
You keep mixing my headers, girl. You keep mixing my headers.
But
yes, talk about it.
Can interact with these prescriptions. So you want to be mindful of that too.
Yeah.
But if you're taking all these different prescriptions, you need to let your doctors know that.
And you know from experience how many times you go to one doctor and this doctor does not know that you're on all these medications with that other doctor. And you're on all these medications, and sometimes you're on the same types of medications.
For the same type of thing.
Yes, because DJ Jazz and me don't know that you're on X medications. That's so dangerous.
It is. And then you throw in the men who be on these erectile dysfunction medications, which, by the way, if I could just school y'all a little bit. So the origin of Viagra was created to help with heart conditions. Okay?
That's why it makes me so nervous.
They just discovered through the clinical trials that it was helping men keep an erection.
Just think, the blood,
and
it's pumping, and
they were like, oh,
yeah.
So they were like, okay, well, who all over there? Because this is an issue and it can help. So hence Viagra.
She just taught y'all something. Y'all didn't know that. Say one more again.
The more you know.
Hit that high note one more time for me.
I can't.
No, just please.
Because the lemonade got.
All right,
but the more you know.
Yeah.
Okay.
Yeah, definitely. That was good education for them. You just threw that in there.
I did. I just off the dome, freestyling, DJing, ficky.
So due to the metabolic action of the medications, one drug can actually diminish the effectiveness of another drug. But so that's why it's really important. Doctors would know that.
Right.
They should know.
So I think another thing that has come up like recently, since people get a lot of prescriptions like sent to their house, they might not go to their local pharmacy to get them filled, is the pharmacists at these brick and mortar places like Walgreens, CVS, Rite Aid. If you get all of your prescriptions filled there, they will get an alert that says that there's a contraindication between some of your prescriptions. But let's just say you're having some of your prescriptions sent to your house. They're not necessarily going to know about all of those.
Let me ask you something, Jasmine. Like when we go to our doctor, right? Like where our PCP is, most of my doctors are there. When they log in to their EMR, they can see what other medications I'm on, even if I went somewhere else that is not affiliated with them. Yep. Does that have something to do with all scripts or something? Or am I making that up?
I forget what it's called. It's not Express Scripts because that's it's a different software. It's like a national database of you're filling your prescriptions. Yes.
Okay.
That's how they get that. But only certain EMRs get a download of that information. Okay. So if you're on one that's web based and is highly connected and has a connection to that prescription database, then they will get everything that you ever filled in your life, pretty much.
So that's why they always have
stuff. That's why they always have it.
Because when I went to go have my surgery in Connecticut, and he gave me antibiotics and he gave me pain medications, when I went to my PCP appointment 3 months later, I was like, who all over there? How did y'all know that I was on medications? Right. And so that's probably what happened. That would be the most beneficial thing if that was like some type of requirement for these places to have, but not everybody's even on an EMR.
I know some people still using paper, and that's the downside of using paper.
And if you are a drug seeker, and if you know how to manipulate the system, you could possibly have one doctor who's paper charts and another doctor who's not paper charts, and you could be getting the same medication or the same type of medication. Like I can be getting Vicodin from one doctor over here and getting Percocet from somebody over here.
Yeah, and people do that, but just know if you try to do that in New York, it's hard, okay? Because they have systems in place that will alert them that you were prescribed an opiate.
That's what just happened, though, at my job a couple of weeks ago.
Yeah.
No, they figured it out, but after the fact, after it was filled.
Well, they're not following protocol then.
And actually, one of my employees figured it out because she had to reach out to the psych doctor, and she's like, the payer, one of the insurance companies, sent something saying this patient is on these 2 medications, and both of these medications affect the CNS.
Central nervous system.
Yes. And so she had to reached out to multiple doctors, and nobody wanted to actually take credit for it. Some of those dots were not connecting. Yeah. So they found out after the fact, and that's because one of the insurance companies figured it out. Ooh, child. Okay. From the claims.
Because if you fill your prescription through your insurance, we get all of, I'm saying we, I'm not an insurance company, but they get all of that information, and so they can identify it as well. But by that time, Mr. Fred done took the two things together, and he's dead. He's gone on to glory.
He floated on to glory on his little magical carpet.
Yeah, and by the time we get that information back to your PCP, you're dead. So, like, you need to know beforehand.
Yeah, you got to protect yourself too, people. Like, seriously.
You have to understand what you're taking. You will be surprised how many, especially older people, come in and they'll say, I'm on the red pill and then the blue pill and then the white pill and the little round one. No, you need to know the names of your medications, the dosage of your medication. You need to know, what it does, when you're supposed to take it. Because sometimes you can't take this one with this one, just like we're talking about. Like, you need to know this for yourself. So if you don't, you can always go to your local pharmacy and have a conversation with the pharmacist there. That's what they're there for. You know, sometimes you'll see the little window that says consultation. You can even just go and ask a question. They'll help you.
Yeah. And when I was a floor nurse, sometimes we would have those patients who are like the blue pill, the green pill, da-da-da. Then we had other patients who would be like, what does that do? What does that do? What is that called? And I used to be so proud of them. Like, look at you advocating for yourself. You're not going to just let me give you any medication.
Right. When my mom had to be in the nursing home real quick after her surgery, she got those people all the way together because she's been a nurse for a lot of years. 50, I don't know how many years.
A long time.
Yeah. So 50 plus years. One of the aides came in the room saying, oh, I'm here to give you your medicine. And she said, what is it? She said, oh, it's a little blue pill.
Oh, no.
She said, what is the name? Anyone who's met my mom knows she don't play that. And so she got them all the way together. Nothing. She doesn't. She really doesn't. So she was teaching them how to be better aides and nurses, right?
In nursing school, clinical instructors will tell you, do not give a medication unless you know the dose, unless you know why you are giving it.
You shouldn't.
And unless you check that chart. So she just bringing her little blue pill. No, ma'am.
I'm hoping that the nurses that were there were actual nurses and not ones that bought their license from Florida during COVID.
Yeah, it's a possibility. Because they did say some of them were practicing up here in New Jersey. Remember that?
I could see.
Man, you should have bought one when they had one on sale.
Me and you. Girl, you already got yours. Me.
I said, man, you should have bought one when they had one on sale.
Yes.
Because that's all you missing.
I missed that sale. Could have been an MP by now.
Yes.
Could have used that RN and flip it to MP. Missed my chance.
She missed her chance.
I didn't know they were selling them.
Oh, child. Okay. Why are we like this?
I don't know.
We ask ourselves that all the time.
I get.
Okay, so another thing that's important, which Jasmine touched base on already, is reporting supplements to your doctors. When you are in that room, and if you have a good doctor, either them or their staff will do medication reconciliation. They will say, hey, are you still on this? Are you still on this? Are you on anything new? Right?
They should. And if they're not, they'll find a new doctor.
Yeah, they should. But, right? Please let them know if you are on any supplements. So I have an example that they actually taught us in nursing school, and I didn't remember it until I actually looked it up. So pretty much, depending on the drug and on the supplement, it can go from you having some type of reaction that's just uncomfortable to it being disastrous. Say that? Disastrous?
Disastrous.
Disastrous. Did I say that right? Okay.
Deadly.
Okay, float on up to glory.
Go to glory.
Yes, okay.
We stay sending people up to glory in these episodes.
We do.
There's no in between.
You either dead or you're alive.
Right.
That's it.
I mean.
And if you don't do some of these things we telling you to do, you are going to be on a one-way ticket on home to glory.
Yeah. You can't play around with medications. You will go on to glory.
Yeah.
Or down below.
Whatever down below. Oh!
I don't know. We send everybody to heaven. All dogs go to heaven.
So, taking ginkgo, which I took ginkgo when I was in nursing school at NYU.
Trying to help your memory?
To help my memory because the workload is just the hardest thing I ever did in my life. So, I actually took ginkgo. But I wasn't taking anything else. Nothing else but the ginkgo. Okay? So taking ginkgo and taking something like a blood thinner like aspirin or even taking vitamin E, child, it can all increase, taking them together, can increase your chances of a bleed.
Ooh.
Yes, because they're like all on the blood thinner side.
Oh, okay.
Yes. So this is why supplements are important, because if your doctor wants to put you on a blood thinner and you over here popping ginkgo every day because you can't remember to take your medication, so you want to take ginkgo, you need to let your doctor know this.
Yeah.
You really need to let your doctor know that. And taking, so pretty much taking any of these can also cause an internal bleed. So not just you shaving and you're bleeding like crazy and it's hard to stop the bleeding, or you brushing your teeth and you cut your gum and you're bleeding now. No, they're talking about internal bleeds, child. All up in here bleeding. Yeah. So it's important to make sure that you let your doctor know if you're on any supplements. And when we say supplements, we talk about vitamins, any of those things.
Things you bought off the TikTok shop, okay, that you don't even, because these supplements are also not regulated by anyone, right? You may see different organizations that have approved it, but they are not regulated by anyone. They could be putting anything in these supplements.
That's what you were talking about.
Anything. They could be putting wood shavings and
ashes,
toenails, right? Ashes from the fireplace that you're supposed to wash your face with. Apparently, they could be putting anything in there.
Yeah,
baby's breath and dog knuckles, whatever.
Dogs have knuckles?
I don't know. They could be putting anything.
They could be putting anything in there. Jasmine is 110% right. So it can increase the risk of internal bleeding and stroke. So I'm assuming it's not. I'm assuming that they're talking about a hemorrhagic stroke.
Okay.
Because they're talking about bleeding. So that's like bleeding on the brain, guys. So I'm thinking that they're talking about hemorrhagic stroke. So not only can you bleed internally down here, but it can cause a hemorrhagic stroke as well. Look at this. Look at how we educating them. Y'all better take notes.
That's scary.
It is. But what's even scarier is if y'all not listening.
Yeah.
Okay? Stop taking these medications like this. Stop doing all the stuff that we said not to do. And I'm going to stop it too.
Me too.
Oh, yeah.
Also, foods can interact with medications too. I can't remember which medication it was.
Was it garlic? Something with garlic or something?
Oh, I don't know. But there's some medication that you're not supposed to take with, you're not supposed to eat grapefruit.
Oh, yeah. There's certain antibiotics where you can't eat grapefruit, and you shouldn't have certain acidic foods.
Yeah. Because
you didn't make that up.
It's an interaction.
Yeah. And it can decrease the effectivity of the medication.
Is that
and be careful.
What did you say? Effectivity?
I don't know if that was a word, but damn it sounds good. So one thing y'all gonna learn about me is I will make up a word. You can ask Jen.
Right.
I will make up a word, okay? Listen, the highest level of pistivity is my favorite.
Effectivity.
The effectivity.
Yeah.
Whatever. Sound good to me. It's in the dictionary of Kim.
Right. KIM.
What was that? Oh, also, you ladies who are of childbearing age, who are on birth control pills, remember, well, hopefully your doctor told you, or you should have read the pamphlet that comes with it. Taking antibiotics can decrease the effectivity. The effectivity of the birth control pills. So if you don't want to be out here at your baby shower 9 months later, use another form of protection as backup. Do you remember?
Good point.
Do you remember that when you were on birth control? I remember from when I was on birth control for those 7 years.
Yeah, I remember that.
Because what Boo was not gonna do was get me pregnant.
Yeah.
That was not happening. So yeah, make sure that you use another form of backup, or don't do it. I'm gonna tell you. Okay, so lisinopril. Well, are we done with reporting the?
Well, speaking of internal bleeding, I just want to throw a quick PSA out there to, if you are supposed to be eating with a medication, make sure you do that, right? They tell you that for a reason, so that you can coat your stomach, so that the medicine doesn't rip your stomach to shreds. Some people out here taking ibuprofens on an empty stomach.
Any NSAIDs on an empty stomach.
Any NSAID on an empty stomach, not a good idea.
Yeah, like so that would be aspirin, Aleve, ibuprofen, Advil, any of those things.
Oh, another thing I just thought of. It's Sorry. When you take these, and I actually learned this from you, Kim, years ago.
What did I teach you?
When you take these NSAIDs, you should not lay down right away for 30 minutes, okay? Because it can, over time, if you continue to do that, you can get esophageal.
Yes!
You can get esophageal cancer, okay, guys?
You are such a good student.
I am. I listen. I pay attention. I need you all to know this, okay? Because I didn't know this. And sadly enough, one of the Braxton sisters, and I'm not saying this is why she had it, but I can only imagine, like, hey, I didn't know this until my 30s, and I've been taking all types of ibuprofens and laying down.
So normally it causes erosions first, which they can identify during an endoscopy or an upper GI.
Mm-hmm. But that's only if you're going or if you have some symptoms.
Yeah.
Also, the same goes for doxycycline or any of the tetracyclines. You have to wait 30 minutes before you lay down because it also causes that same type of erosion in the esophagus.
Girl, when I tell you, I think we should wear a cap and gown next time we have.
The more you know.
Yes. And then also to just reverse just a little bit back to what you said about the eating on a full stomach. Everything that Jasmine said is 100% accurate. But also, some medications have better absorption on full stomachs, and some medications have better absorption on empty stomachs. So like Jasmine said, do what they tell you to do.
Read. Reading is fundamental.
I told Corey that the other day.
You did?
Mm-hmm. Because she wanted to watch TV. I said, read books.
Yeah.
Reading is fundamental.
It is.
She said, no, it's not. I said, no, it is.
Because when you become an adult and you can't read that prescription bottle, all right, don't come after me.
And you eating when you're supposed to take it on an empty stomach.
Right. And then you over there throwing up. Or not.
Yeah. So listen to us. We know we talking about, John.
Yeah, we got you.
Okay, so the other thing I have here is lisinopril. I wish we had some dun-dun-dun-dun type of music.
Right. Dun, dun, dun.
Yeah, lisinopril. So it's an ACE inhibitor, right? So that's the drug class, ACE inhibitors. I personally always tell people that I care about, not patients normally, but
because you don't care about them?
No, just because I don't want to
people in your life.
I don't want to cross the line of professionalism and my personal feelings.
Mm-hmm.
But for people in my life that I care about, friends and family, I tell them stay away from the ACE inhibitors, please. So when I knew that my husband had high blood pressure and I had him keep a log for a month and then he took it to his cardiologist, they called me on a 3-way and he was like, yeah, based on his readings, he does have hypertension and he does need to be on some type of hypertensive medication. And he was like, what I think I'm going to put him on, I cut him off. Oh, sorry. I scared the dog. I cut him off. I said,
Peter's like, who's shooting?
No ACE inhibitors. At all. So he was like, no, I was actually thinking of a calcium channel blocker like Norvasc. I was like, come with it now, come with it. Norvasc is a good place to start, which is also known as amlodipine, right? So lisinopril is a specific ACE inhibitor that black people, before I get into the blacks, it treats black people. It treats high blood pressure, and heart failure, and it also helps to prevent strokes and kidney problems and heart attacks because it causes the blood to flow easily. So just think, high blood pressure, your blood is not flowing like it should be. So more volume, more pressure. So it's like building up, which causes hypertensive readings, right? So if you're taking something like, let's say, Norvasc, or lisinopril, and it's just making the blood flow easier, so your pressure is lowered. Does that make sense? I'm trying to give these people a little bit of education.
Sure. Mm-hmm.
You are following me.
I just needed to do what it needs to do. All of that, of what you just said, sounds so cool, but yeah.
So for some reason, African Americans, they have an increased risk of angioedema, right? So that's like the swelling of the hands, the face, the throat, the mouth. I wish we had a picture to pull up to show them. And lisinopril has been known to cause that, right?
Yes, in African Americans, like, but why? Like,
well, I found out why today. I never knew why.
Is it because we have melanin?
I just said stay away from lisinopril.
Right.
I never knew why. So it says ACE inhibitors work best when the cause of hypertension is a high level of renin. Okay.
Well, who said that? What is
But
that?
Black adults with high blood pressure often have a lower level of renin. Who did the body?
And who is Renan? And why?
I don't know who renin is.
Is he all over there?
I don't know who renin is, but that's what I found today during my research.
Ugh.
So I always tell African Americans so that's the reason, because earlier you asked me if we're all the same, why is it that like black people don't do well on it?
Okay.
And they tend to have angioedema.
Well, it's renin and not melanin.
But girl, it's the inin.
Right.
The that you have, right. Yeah, so listen to this. When an African American has hypertension, it's better to start with a calcium channel blocker, like I mentioned.
That's the Norvasc, right?
Norvasc.
Okay.
Or amlodipine, it's the same thing. Or a thiazide, which is a diuretic.
Like hydrochlorothiazide.
Hydrochlorothiazide, exactly.
I just pulled that out.
Exactly. So, people, if you have hypertension and you go into your cardiologist, tell them, I'm not doing no ACE inhibitor, okay? There are other things that I can take out there, and why don't you start me off? Now, if you don't want to do something like a thiazide, because you don't want to have to go to the bathroom, and because that's like
it's a diuretic?
Yes, it's a water pill. But they normally mix it with some type of hypertensive medication. Just try to go
so like a combo.
Okay. There you have it. There you have it. So just keep that in mind, people. Ooh, child, we teaching them out here. Somebody get me a chalkboard.
This is good. We preaching.
Somebody get me a chalkboard.
Right.
And some chalk. Okay. And that's all I have for us for this medication session. I don't have anything else. Do you have anything that you wanted to touch base on that we may have skipped over?
Don't be taking other people's meds, okay? I know people do this all the time, but if you have a friend that has some stuff, don't take other people's meds. That is akin to taking expired meds. You don't know if it's going to agree with you. You don't know if you're going to die. They don't know what other medications you're on. Just don't do it, okay?
My cousin killed himself by accident, and my Aunt Lisa can tell more about this story. He took his girlfriend's asthma pump, I guess, one too many times. And I don't even know if he had asthma.
How you died from that? Who said that?
It didn't work out for him. He died. He went on home to glory.
Oh, well, I guess. Okay.
Yeah. So that's a perfect example of stay off people's medications. I don't take people's medications. That's one thing I don't do. Do I?
Yeah, you do.
Ooh. Oh, you have given me some.
I have, but
that is a Xanax. I needed it. I needed it.
Yeah, and you've had it before, so you know. But in general, don't be like us. Don't do as we do. Do as we say. Okay? Don't take I've taken other people's meds as well.
We take each other's medication.
But it's not recommended. Don't do it. And
I guess I lied.
I think because we mentioned all the other stuff that we wanted to cover. Talk to your pharmacist if you have questions. Antibiotics, don't do it. Don't take other people's medications. Make sure you read the instructions that come with it. If you don't understand, talk to the pharmacist. Try to fill all your prescriptions in one place, at one pharmacy.
I got one.
What?
If you can't afford your medication that they are prescribing for you, don't just say, I'm not getting that because I can't afford it.
Yeah.
Have the pharmacist reach out to your doctor if you're still in the pharmacy, or you can reach out to your doctor yourself. They can give you something else.
Yeah, they can. And if it's not something that they can give you an alternative for, try a service like GoodRx or something like to get a coupon and get it without your insurance. And many insurances have programs where they can help you with financial assistance too. Yeah. You just have to look into that too. So, because these prescriptions can get expensive in these streets, especially them diabetic ones.
Yeah, they can.
Yeah.
All
right, guys. Well, that is it, right?
Yeah, that's it. Well, tune in next time for more Snitches.